Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Well, hi, everyone, and thank you again for joining us today on the Action on Pain podcast. It's great for all of us to be back recording. We took the summer off. It was a great summer. Out here in the West, at least in British Columbia, it was smoking hot, and I think it was actually all across Canada. And I experienced that heat because I just traveled across the country with my wife and the dog from coast to coast. And I got to see beautiful Canada from end to end and got a chance to see two of my favorite people in person, Jen and Virginia. So it's great to be back in the studio with them and having another great conversation today.
That's wonderful. And it was pretty terrific seeing you in Ottawa, Keith, along with your wife and our mascot, Parker, your dog. It was great. So my name's Jennifer Daly-Cyr, and I'm joining today from CHUM, the Hospital University of Montreal Hospital Centre, and specifically in the Research Centre today, where I'm participating in a strategic planning session for the Chronic Pain Network.
So I'm Virginia, and I get the great pleasure of actually introducing Dr. Andrea Furlan, who is a dear friend, and I have known for years and has been really a key partner with the People in Pain Network and has helped people within our network self-manage and live with their pain. So I'm going to give a little bit of a bio on Dr. Furlan. She is a physician scientist. She is a professor in the Division of Physical and Rehabilitation Medicine in the Department of Medicine of the University of Toronto. Andrea's research is focused on management of chronic pain. This includes diagnosis, treatment, and education. She was the team leader who developed the Canadian opioid guidelines in 2010, impressive, and she developed a tool and app to help physicians apply the guidelines recommendations. She is the chair of the ECHO Ontario Pain and Opioid Stewardship Tele-mentoring project that aims to teach clinicians in rural and underserved areas how to help patients with chronic pain live better. And you might know her through her YouTube videos, which I know I use and use in our People in Pain Network quite often, and are thrilled that Dr. Furlan even developed one as a request for us on goal setting so we could use at our sessions. Thank you. So we are very eager to hear your insights on the action plan for pain in Canada right now. Pleasure to welcome you, Andrea, and to see you.
Yeah, it's my pleasure to be here. Yeah, thank you so much. This is such an important podcast. Congratulations on starting this in Canada.
Thank you very much. We're very excited.
I already subscribed, and I'll give you 5 stars.
All right.
Yeah.
Oh, well, thank you very much. Thank you. Thank you.
Listeners, are you hearing that?
Yeah, there you go. Great.
You deserve it.
Oh, thank you. We're very, very excited and quite passionate about this particular initiative, and hearing from each and every one of the guests. It's been a learning experience, without a doubt.
Yep.
So, Dr. Furlan, we wondered if you could start us off by, we're always interested in what's happening in current research in chronic pain. And can you tell us a little bit about where your research focus is in a moment? And then we'll have a chance to chat about the action plan specifically as well.
Yeah. So what I do mostly is knowledge translation. That's where my research has always been, my career, my publications. What this means is someone do a primary research, like they do studies in laboratory, or they do studies with humans or animals. And then I synthesize, and I have lots of systematic reviews that I publish. I publish a lot of Cochrane collaboration, meta-analysis. And then I publish guidelines, which are like almost like a synthesis of the systematic reviews in a topic. And then you create some guidance for clinicians to use that. So that's mostly what I've been doing for my whole scientific life. And then more recently, in the last 10 years, because my career expands 30 years, the first 20 years were doing systematic reviews. And then the last 10 years, what I've been doing is trying to convey these messages of these systematic reviews and guidelines directly to clinicians. And that's how I brought Project ECHO to Canada. with Dr. Ruth Dubin, a family physician from Queen's University. We both learned about Project ECHO and established the first ECHO in Canada, which was for chronic pain opioid stewardship in 2014. And this is a network that we use a telehealth platform like Zoom, and we connect a team of experts. We call this a hub, expert hub, experts in a topic. In my case, chronic pain and opioid substance use disorders, addictions, with primary care providers. And these are people like family doctors, nurse practitioners, physiotherapists, pharmacists, you name it, any healthcare profession who they need a connection with a team of experts. And we are their hub. We connect every week and they bring their cases. They bring real cases to the sessions. We discuss. Everybody who is attending an ECHO session learn about, pain management with that case that is being discussed. And everybody teaches because not just the experts teaching them. We all teach, we all learn. It's a great, great community. And I did a lot of research with this community. I published more than 11 papers based on our ECHO over this last 10 years, showing that clinicians who participate in ECHO, they feel less isolated because these are people in rural areas, remote areas. They don't have access to like an academic center sometimes. So we are their expert hub. They feel very free during the ECHO sessions to ask questions that they would be embarrassed to ask, in a conference. Like if you go to a congress, a conference, you will not be raising your hand and asking a question that you may be judged because you might be wrong.
Right.
So the ECHO community, we show that they feel confident, they increase their skills. And we create this community of practice that everybody feels like you are among friends. We have a person with lived experience in our hub. And she participates in every session talking about her experience, teaching those clinicians what it means to be on the patient side. So it has been great.
That is amazing. And I just wanted to jump in here for a moment because we keep having these conversations with people like yourself who we learn are trendsetters and trailblazers. And you said you brought, in collaboration with one of your colleagues, ECHO to Canada. And I know I've been very familiar with ECHO, but I didn't realize that you brought it to Canada. So that's amazing. And I just love how you shared that some of the healthcare providers, this is their safe space to be able to ask the questions that they normally couldn't. And all that return on investment to them has got to be tenfold because now they bring that back to the people that they serve. So
and brings an insight into the human experience as well. So thank you very much.
I like how you have a person with lived experience on that hub. I mean, kudos for that and seeing how important that is.
One of the papers we published was we asked the participants in a focus group what they thought about having a person with lived experience in the hub.
yeah.
And the feedback was amazing because they said, she can explain so well what the patient is thinking. How do I communicate better with that patient? Because sometimes clinicians, we have hard messages to give to the patients and we may not use the proper words.
Yeah.
So in these ECHO sessions, we talk a lot about communicating with patients using a language that is accessible, not judging, not stigmatizing. We're not just teaching them how to prescribe, deprescribe, and choose this drug or that. It's more about how you approach a difficult, complex patient.
Yeah, keeping that person in mind, not the symptoms, right? The person. Yeah, thank you for that.
It's so great to hear because if we go back, and we don't have to go back too far, too many decades really, or years, people with lived experience, I think there was a bit of a challenge with sort of bringing them into healthcare. And I understand for lots of reasons why, and some of it was just maybe uncomfortableness with that. But to hear that the participants are open to that and they appreciate it, tells us, because we don't see it sometimes on our side, see how far the movement of integrating people with lived experience is coming. So again, thank you for that. And it's great that you've been able to share that. It's been very positive.
So Andrea, you talked about, that's the way you have used the ECHO platform or hub that you brought here to teach clinicians. I'm very familiar with your work on your YouTube and your books with the Leave People in Pain Network. Can you share what you do for people living with pain and why you've gone down that avenue to share these things and these education components for people with lived experience?
Yeah, it was a natural consequence, Virginia, of what I was doing teaching the clinicians. Because I noticed, like when I published the guideline in 2010, the opioid guideline, telling clinicians, I went also from coast to coast, teaching clinicians about the new guideline, right? And then they had a question saying, I know now what the guideline says, but who's teaching the patients about what the guideline says? Because I don't have time to spend, a lot of education time in my clinic to explain these things to them. So who's doing the other side of the table? And then when I started to echo, I heard the same thing, like in an echo session, like we are discussing one case. And interesting, one person presents a case, but then you have 50, 70 clinicians who are listening and learning from that case discussion, right? And then the questions were, okay, I know what I have to say, but my patient doesn't understand this. Especially, for example, if you are talking about reducing the amount of drugs that they are using. A lot of people rely on pharmaceuticals, and we know they are not the best interventions to treat pain, and you want them to change their lifestyle. You want them to sleep better. You want them to exercise more. You want them to focus on what they are eating less junk, etc., etc. How do you talk about all of this? And then it came the idea that I had. I said, okay, I spend time with my patients, sometimes repeating the same message over and over. Like in one day, I probably repeat the same script 5 times. And I said, the patients are tired at the end of the consult with me. They're not in the learning mode. And I'm talking a lot of difficult words for them and expect them to remember all of this at the end of the consult. So I decided with my own cell phone at home, this was 2019, I said, I'm going to record those scripts that I repeat 5 times a day and put on YouTube and just tell my patients. I didn't want anyone to know that I was a YouTuber. I did not even tell my parents. I was afraid of being judged.
Right.
YouTubers are people who dance and are entertaining. They're not serious.
Yeah.
So I just told my patients, I said, you know what? I'd love you to hear about this piece of education here. Like I give them a diagnosis of fibromyalgia and they ask me, what is fibromyalgia, Dr. Furlan? And then I was repeating. And so I said, go home and watch me explaining what is fibromyalgia. It's a 17-minute video. You can watch their closed captions. Now I have closed captions in more than 56 languages. I even
Amazing.
have audio in more than 11 languages.
Wow.
So go home and here's the link. And they came back and they loved it. And now, not only my patients love it, but my parents are very proud of me now. My mom is the first one that she recommends my videos to her friends. Yes, so I think that those messages reach a lot of people because I use a simple language, a lay language. I try to avoid jargon as much as possible. I put, when I'm talking about a difficult, complex word, I put the word on the video, explain what it is. I do a lot of videos demonstrating exercise because I really believe exercises is the answer to a lot of our problems with chronic pain, but people don't want to do exercise because it hurts. So I think they complement each other. I think the echo, I'm teaching one side of the table, the clinicians who are talking to the patients. And with the videos and the books, I'm educating the other side of the table. So I hope that when they meet each other, they will be able to understand each other.
I love how that began. I just love how you describe how that began and how important it was to spend that time in clinic doing other things that you could offset with your videos. And fabulous. Well done.
And I love the fact that you recognize that these were important conversations to have with people, but you recognize that in the moment that maybe they weren't in the right space to be able to hear you. So instead of just not worrying about that, you've provided this platform where in the comfort of their home, when they're in the right mindset, they can listen to it again or whatever they need to do. So I'm just going to offer, Dr. Furlan, that is just a beautiful example of person-centered care, meeting that person where they need to be. And so instead of saying, here's what I believe you need to do, you recognize what they needed and then created that platform. So, and you've talked, a little bit about, your research work and work with, both teaching clinicians and people living with pain. And I think that really speaks to one of the action plan's goals, which is kind of goal 3. So are you able to expand or speak a little more about sort of because we're really trying to help highlight the action plan because it's an amazing document. So we'd love to hear your thoughts on how you feel your work ties in with that number 3 goal.
Yeah, so I was glad when I opened. I did not participate in the development of the action plan, but when I opened the action plan and then you look at all the action, the goals and everything. And I'm the kind of person that would love to do all of those.
Right.
I want to do 1 and 2 and 3 and 4 and 5 and 6. But then I can say, Andrea, stop. You are not a superwoman. You cannot do everything. We have a Canadian network. Just choose one and do it well. Right. So I said, okay, let me just, slow down and, see, I love to participate in everything possible. So when I opened and I saw goal number 3, I said, okay, I think I'm doing this and I'll try to do my best. And I will try. So the goal number 3, which is, educating, giving skills and knowledge and support to people living with pain and also healthcare professionals who treat those people. Mm-hmm. So with my 2 projects, Project Echo, and a few other things that I do in that area too. I have online courses for opioid prescribing that were developed with Health Canada as well, and a lot of other lectures that I give. But I said, okay, I'll try to tackle goal number 3, do it well, do research, collect data, and even mentor other people who want to do this. If there are other clinicians in Canada, I don't need to be the first one and the only one. But I think we need other professions like physiotherapists who are treating people with chronic pain, pharmacists. We need surgeons. We need, people who are communicating well with the public, because the amount of misinformation on social media, on websites, people who are trying to profit out of people who have chronic pain is enormous. So we do need reliable people, scientists who have a voice. It's scary. It takes a lot of time, and you will be attacked. You will be judged. People will say nice things, but also horrible things about you when they don't agree with you. It's not easy. It takes a lot of effort. If you don't love this, you're going to give up quickly. But I think if you have this as a mission and you see that you are helping people in distant areas of the planet, it's amazing. My videos are watched in countries that I'd never heard about it. And I can tell you one thing, if I can stimulate other scientists to do this, when I was promoted to full professor at the University of Toronto, which happened last year, they looked at my dossier, and what was most impressive and this is the decanal committee of the University of Toronto, which is very hard to be promoted. They looked at the impact that I had with my YouTube channel, because they asked me to put together the analytics. They said, how many countries are you seeing? And when I looked, it was 192 countries.
Wow.
And more than 60 million views.
Incredible.
And you're reaching that many people. Yeah, and the comments, they asked me to summarize. I could not summarize all the comments because there are so many people who are helped. And there are countries that, as I said, I never heard about it. If I go to that country, I have more views in that country, like the countries are small, than there are people in that country. So,
wow.
So yeah, the impact is amazing. And what gives me the energy to keep doing this is when I see the comments that people write on my videos. People who are in Africa, in countries like Russia, Ukraine, South America, and they thank me for learning more about their conditions, to giving them hope, to be more, knowledgeable, to even discuss things with their clinicians. This is what really pays me for doing all this work. It's amazing. It gives me chills when I talk about that, because I remember stories and stories of the impact of this. YouTube is really a megaphone that we can use wisely. If we use wisely, it's a tremendous tool for clinicians and scientists. And Andrea, where I know you well, there's more than your YouTube. You have gone out that people, not everybody learns the same. So I know you have books done and you have a website. So what made you decide to expand even those areas? So it just, like I said, everybody learns differently. I do what people ask me. I listen to my audience.
I listen, like when I was doing echo and the clinicians were saying, well, but the patients don't know what we are talking here. So I said, okay, a video. And then when I started doing videos, I got people saying, do you have a book? Do you have a book? I said, oh, maybe I need to write a book. So I wrote a book. Do you have another book? Do you have? So then I wrote a second book. Do you have things that we can download? So I go where people ask me to go. I go where the need is. And not that I want more work, but...
well, right. Do you have a team that supports you? Because you have a full-time job and you're doing so much, to Virginia's point. Like you're, as you said, following what people are asking you. So how do you find the time to make it all happen?
Good question. I don't know. I think
yeah.
It's me and myself. And
okay.
So my son still agrees to edit my videos. So he probably knows a lot about pain because he saw all of my videos. And my daughter is the one that helps me to record on the recording days. But when they're not available, if they can't edit, if they can't record, I can do everything. Editing, I do all of this myself.
I love that it's a family affair, that your mom, your daughter, your son are all very much involved. Yeah, that's beautiful.
What I love is, when you started talking, you said you got into this in 2019, just you and your cell phone. You didn't want to tell anybody because, YouTube to be seen as sort of not real, not professional.
Not serious.
And in a short period of time, you have taken your work and it is extremely professional and it's obviously reached around the world and it is seen as a professional tool. Now, notwithstanding that, it sounds like you're still open at times to some criticism or some maybe not support from some of your colleagues, but you have stuck to your convictions and you have really made an impact, not only in Canada, but around the world. And that is truly amazing.
Like my mission. Yeah. When I was a child, my mother tells me when people ask me what I wanted to be when I grow up,
right.
I had two answers. I said, I want to be a teacher because my mother was a teacher, and I want to be a doctor. And when I chose medicine, I thought, oh, I have to choose one. I can't. And now I realize I'm both. I'm a doctor and I'm a teacher. So coming back full circle, I think I fulfilled my mission in life.
That's beautiful.
And Andrea, I certainly think you have, and that brings into those important goals, like I said, an educator. Now that we're kind of coming to their end here with you, we'd like to thank you for sharing your time and your expertise, and hopefully we'll have you back sometime. I think there's so much we can learn from you.
Yeah, absolutely.
My pleasure.
I want to, to what Virginia said, I just want to thank you for not only taking your time to be with us today, because I know you're very busy, but for all that you have done and just having that sort of strength and the courage of your convictions and empathy and compassion to stick with your people you support and meet them where they need to be. So that is truly incredible. So I believe you're a bit of a unicorn. I'm starting to plaster people up on my wall about people that are leaders, and I'm going to have to find space to put your picture up on the wall as well.
No.
I certainly got the books.
There you go.
Yes. Yeah. Fabulous books.
So with that, we'd like to thank everybody for tuning in today for this episode of Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada as guided by Health Canada's Action Plan for Pain in Canada. And we'll see everybody next time. And again, thank you, Dr. Furlan, for joining us today.
Pleasure to be here. Thank you so much.
Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.